Hello everyone, my name is Priya and I'm a fifth year medical student in Malaysia. Welcome to my second video on communication skills, and today's video is going to be a little challenging compared to the first one. As the title says, explaining your mistake to a patient and how you are going to respond to your patient's reaction as calm as possible. You will almost definitely encounter these kind of situations in your placements or when you start working as a doctor. There are so many things that we need to take into account when it comes to dealing with angry patients, because you need to accept your mistake and acknowledge the patient's anger without getting impulsive or defensive. So I'm going to go through some key points during the consultation, and like previous video, I'll be showing you a demonstration of me and my friend so that you can have a better picture and use this to practice your communication skills. All right, let's crack on. Firstly, recognize that the patient is angry. They might be a little loud to you, they might verbally abuse you, sometimes they might use some swear words or they might frown. So once you have recognized that the patient is angry, adjust your style of communication in terms of the tone, the speed, and the volume of your voice, and maintain a good relaxed posture. Body language is very important. Third, try to understand why they are angry. Asking open questions will be better to identify the focus of why they are angry. And this is where you get to apply your active listening, such as eye contact, nodding, verbal response like Next, once you have gathered information about why the patient is angry, you should respond to their anger. Demonstrate empathy towards your patient by acknowledging and appreciating their emotions. This is how you are showing that you truly care for your patients, and if there has been any error, apologize to the patient and make sure to inform them these mistakes are taken very seriously and reports will be filed to ensure things like this do not happen again. And by asking patient or relative if there's anything you can do for them, again you are showing that you care for them and you care enough about the situation that you wish to help rectify it. Always, always, always conclude the consultation by thanking your patient. There are some things to avoid when speaking to angry patients, such as getting angry yourself. Try to remain professional and be mindful. Next, being defensive. It might feel like a natural thing to do, but try to avoid the temptation of responding defensively because this can actually escalate the patient's anger. However, sometimes, regardless of the conversation, patients may still want to file a complaint, and as a junior doctor, you still have to give the proper information to do so, such as the contact details or the procedure to do it. Alright, important point. If you ever feel threatened by the patient's aggressive behavior, such as having difficulty controlling their emotions and anger, you have to remove yourself from the situation because you need to prioritize your safety and call for some senior doctor's help. Finally, never ever ignore how you feel after the consultation. So in this matter, talking to your colleague after the consultation can be helpful and therapeutic. If you want to cry it out, take a 10-minute break and relax and try to reflect on what you could have done better. Or you could also talk to your clinical supervisor and senior colleagues in terms of adapting yourself when it comes to difficult situations like this. Last but not least, mistake is a mistake. Your patient deserves to know everything. Just because you made a mistake doesn't mean that you're a bad doctor, right? You made a mistake, admit them, learn from the mistake, and that's how you become a great doctor. Let's have a practice. This is your case. On 20th December 2020 at 5 p.m., Mary Jane, aged 65 years old, presented with increasing breathlessness, productive cough to the emergency department. On admission, she was feverish, tachycardic, tachypneic with low oxygen saturation. She denied any orthopnea, chest pain, or palpitations. As a Foundation A1 doctor, you did the physical examination and found that there is reduced air entry on the right side with inspiratory crackles on the right lower zone. You checked the chest X-ray and diagnosed as right lower lobe pneumonia. This is a chest X-ray and it's a right-sided lower lobe pneumonia. Now, continuing the story, Mary was admitted and treated with IV antibiotic for community-acquired pneumonia. That night at 12:30 a.m., you were asked to see Mary due to increasing breathlessness and confusion. The on-call senior doctor reviewed the chest X-ray again and it showed right pleural effusion, not a right lower lobe pneumonia. On further investigation, it appears that the admitting FY1, which is you, incorrectly reported on the chest X-ray of another patient. As a result, a diagnostic aspiration was done, then an intercostal chest drain was inserted. Pleural tap confirmed the diagnosis of empyema. Mary was transferred to the ICU, is sedated, and started on ventilation. Now, your task is to meet the daughter of Mary Jane and explain to her about your mistake and update her about her mother's current condition in the ICU. Let's begin. Morning, Miss. May I quickly confirm that I'm talking to Miss Christina, daughter of Mary Jane, age 65, who was admitted last night for chest infection?
Yes, I'm Christina.
All right. Okay. Your age, Miss?
My age, I'm 28.
Okay. Hi, Miss Christina. My name is Priya. I'm the junior doctor who admitted your mother, Mary Jane, yesterday night, and I'm actually here to talk about your mother's condition.
Oh, hi, doctor. What happened to my mother? How is she now? I received 5 missed calls from the hospital when I was sleeping last night, and I was asked to come to the hospital immediately this morning. Is everything okay?
Yeah, I can see that you are worried and feeling anxious about your mother. Currently, she's doing well. Her vitals are coming back to normal. If you just don't mind, can you tell me how much you know about what has happened so far?
So last night I came in with my mother at around 5 p.m. to the
Okay.
A&E.
Okay.
And when we came in, she was gasping for air. She couldn't breathe well. She was also coughing some greenish sputum.
Okay.
And she was brought inside after that. And they told me she had a pretty bad chest infection. So I
Okay.
think they gave her some oxygen, some antibiotics. And I wanted to stay with her throughout the night. But the nurses told me to go back home and since she's doing all right and all. And then this morning when I woke up, I was freaking out because I saw 5 missed calls from the hospital in the middle of the night. I was really worried there was something that bad happened to her or whatever. So when I called back, they said to come in as soon as I can. And then when I arrived here to the ward, she wasn't there. And then one of the nurses actually took me to the ICU. And just in the course of 8 to 10 hours after leaving my mother alone, now I'm seeing her in the ICU with tubes in her mouth. So I'm
Right.
very confused, doctor.
Right. Okay, Miss Christina. Last night, when your mother was admitted to the ward, we took her chest X-ray to look for any signs of infection. Unfortunately, I reviewed the wrong chest X-ray, which was supposedly not your mother's one, and I made the wrong diagnosis for your mother. It was actually empyema, which means like a pus in the lung cavity. But then she was treated for some other condition, which was like a right-sided lung infection.
What? So you mean, doctor, that this is all your fault? You looked at the name of the patient wrongly. That's just basic common sense, right?
Right.
How can you do that? This is so careless of you, doctor. I can't believe you did this.
I'm truly sorry for what has happened, Miss Christina. It was indeed my mistake for not taking a look at the patient's name on the chest X-ray film. Because of this, she had a maltreatment. We got to find out about this last night, actually around 12:30 a.m., when your mother suddenly had increased shortness of breath and she was a little bit confused as well.
Oh
And
my God, doctor. How can you all do this?
But thankfully, we had our on-call night team. So they were constantly monitoring your mother's condition. They detected the correct chest X-ray at that time. And it was actually, like I said, not just a chest infection. There was a massive fluid accumulated around your mother's right-sided lung.
But doctor, this is so scary. How is she now? How is she doing now?
Uh, yeah, so we had to poke a small hole to remove some of the fluid and we sent it to lab for checkups. So the result came back as empyema, like I said. So that means the fluid in the lung is actually filled with pus. So we had to remove the pus completely. That is why we had to put a tube inside her chest so that we can drain out the pus slowly. And that's the reason we called you yesterday night to gain consent for the procedure. Since the call to you were not answered and nobody was around, we had to treat your mother, considering what's best for her at that time. Mrs. Mary was very ill, and in order to monitor her condition constantly, she was actually brought to the ICU, and we had to sedate her and start her on ventilation. That explains the tubes in her mouth. so that it can make her breathing better. I just talked to my senior doctor who's handling your mother's case, and currently her vitals are doing well and she's in good hands with constant monitoring.
I mean, I'm glad that she's all right now, but doctor, this wouldn't have happened if you just did your job correctly. Like, how are you even a doctor? Like, these are small things that, can have a big effect on the patient.
I'm truly sorry, and I take full responsibility for my mistake, Miss Christina. I have already informed and discussed this matter with my team, including the senior doctor, the specialty trainee, the consultant. I can reassure you that we will look into every aspect of this incident so that we can rectify the error and to prevent future mistake. I'm glad that your mother is doing well. I hope she will be discharged soon. I really do. This is not going to happen again, Miss Christina. We have the best team working diligently for your mother and other patients as well.
I can't believe this has happened to my mother. I mean, I'm thankful that you at least are truthful about it and you approached me and admitted to your mistake. But I'm still very angry at you. But I appreciate your honesty for being truthful and telling me exactly what happened. So, but how about my mother now? How long is she going to be in this ICU?
She's doing very well now. I'm not 100% sure what will be the next plan of management, but I will discuss with my senior doctor and I'll come back to you as soon as possible so that I can update you on what's going to happen next. Will that be all right with you, Miss Christina?
Yeah.
Okay. If you would like to know any more details from anyone else from the team, I can call my senior doctor to discuss the incident with you. Do you have any other questions, Miss Christina, or is there anything else I can do for you right now?
No, I mean, I'm still mad at you about what has happened to my mother. I mean, this is not a small matter. Like, my mother could have died. So, I want to make a complaint to, like, your superiors.
Sure. Once again, I really do apologize for my mistake, Miss Christina. Yes, we do have the trust office where you can do your complaint there. Let me just guide you the direction. All right. Thank you.
Thanks.